name's Dorett and I'm the Development and Training Manager here at Imkaan.
Hi, my name's Rahni Binjie and I'm the Development Coordinator at Imkaan.
So, we're Imkaan and we will be 20 years old next year. And we are a UK Black feminist organisation. And we are a membership organisation, which means we have members across the UK that are by and for BME, Ending Violence Against Women and Girls services. We deliver a range of services, the main one being that we're the voice for our membership. So we do a lot of work with central government, with policymakers, legislation, to ensure that the voices of our members are heard. We will do, and that will be in the form of strategic advocacy. We also have a research and policy team that work on providing the necessary and important data that's needed for our services by us, for us, and that informs the work. We also have a training division. We're in the training room right now, and we deliver accredited and non-accredited national training programs that encompass things like forced marriage, that look at integrated approaches to responding to violence against BME women and girls. We also have a sustainability team, which is really important because what that does is that works with our members across the country that are constantly in crisis with the climate at the moment and are facing closure or being forced to merge. So the sustainability arm of Imkaan works to support services so that they are sustainable, they can stay afloat and maintain their specialism. So that's it in a nutshell what we do. It's really important that Imkaan exists so that we can be the voice of the by and for BME sector.
So with all that work that we do, we came together with Women's Resource Centre, Positively UK, Rape Crisis England and Wales, Forward and Maternity Action. And we set up Women's Women's Health Equality Consortium in 2008. So we came together mainly because we had a common goal. We wanted to look at women's issues around health and how that's going, or is it working or not. And we worked on a range of issues. We produced a range of reports over those years. And some of the reports we produced were around homelessness and the disadvantages for women around health, older women and health and the outcomes. And these reports are available on the website. So what we wanted to do in terms of, so we're coming to an end of the work, but we wanted to kind of leave something that would be able to be used or looked at, but a legacy of the work that we've done, because we produced amazing work. So some of us came together, so again that was Imkaan, Rape Crisis England and Wales, Positively UK, and we wanted to actually look at health and mental health particularly, in terms of how has policy and practice played itself out. Has it worked, hasn't it? And we wanted to look at a span of the last 15 years. How has that happened and what's been happening or not? So we came together and we looked at, the consultant that we appointed, looked at a range of policies over the last 15 years and looked at good practice, looked at different local authorities and looked at how government has produced policies and how they're being used or not. And what we found was, really challenging because we've got some brilliant policies, across England and Wales around mental health and women. But what we found, even though we had these great policies, was that they just weren't being implemented, they weren't being used. They were created, but in practice, they just weren't being used. We also found that in terms of the violence against women and girls sector and the BME violence against women and girls sector, we were all doing some great work around women and mental health, in terms of women's journeys, in terms of therapeutic services and integrated approach. We're doing some great stuff. However, the services aren't funded adequately in order for those services to continue or to kind of develop a bit further. So we found that even though we were doing all this work and we were feeding into government and into the health service around what's working and what isn't, but it just wasn't funded adequately, and that was the same picture up and down the country. And coupled with that is, what we discovered is that when it came down to the BME Vogue sector, that was funded even less, which, you know, we know that, but looking at it in terms of the last 15 years, there's less and less funding.
The actual report, which looks like this, and will be available on... Is available, sorry, it's currently available. One of the things that came out of this report was key messages that we had for policymakers, government, that was important to have after a piece of work like this. So what came out of that was policy levers, and one of them was looking at where there is, as Rahni said earlier, a disconnect between the great policies that are available and the lived experience. So as a woman experiencing violence, if I approach a mental health service, what does that provision look like? And is that provision really holistic? Does it cater to all my needs? And is the approach an intersectional one, which will look at the different ways I experience violence and how that impacts my mental health? So we also know that the violence against women and girls sector has been doing this work for a long time, as Rahni said, and that was another disconnect between policy and practice, the lack of recognition that the violence against women and girls sector are working with women and girls daily and their mental health needs. And there needs to be that connection between policy and practice, and the recognition that these inequities exist and how that plays out for women and girls' lived experiences of approaching statutory services. So there's a range of tools that are available to help policymakers and decision makers around how to bridge that gap. One of them is the NICE domestic violence guidance that is available. That is really important for statutory services to look at and see what their duties are, as well as and how that plays in with the Vogue sector and what provision we are doing and have been doing. The second piece of guidance would be the National Statement of Expectations, which the government developed, and that would really help statutory service to think through around, again, the Vogue provision that is existent, and what those demands are. What are the expectations that the statutory services need to be upholding, as well as our sector? That would be another piece of guidance for them to follow through, as well as this report, which has all those key messages. And equally, where there's areas of good practice, so where there are places across the country, for example, Bradford Rape Crisis Service, that are doing great work, Camden and Islington NHS Trust, that trained up all their staff according to the NICE guidance, London Black Women's Project that provide therapeutic specialist provision for women and girls experiencing specific forms of violence like forced marriage, female genital mutilation. All these specialisms exist, and it's a way that this report is saying, in order to respond to those inequities, you need to look at where there's good practice, where there's promising practice, and bridging those gaps, so that you have this seamlessness for women from policy to practice. And when women come through the doors of any service, statutory, voluntary sector, that their mental health needs will be met, and will be met efficiently, appropriately, and from that intersectional approach, which is really key. So please follow us on our website, that's www.imkaan.org.uk, and just support the vital work that we do for the Buy-in for BME Ending Violence Against Women and Girls Services. in the UK, as well as the international work we do as well. It's very important in these times that we support the work of these specialist services. Thank you.